My name is Fatin, binti Rahim, and I'm a final year student from School of Physics USM, majoring in medical physics. Sports season, pro football, hockey and basketball are in high gear now, and it seems more and more professional athletes are getting hurt. One of the most critical and some say overused diagnostic procedure to assess the potential damage of a sport injury is the MRI. What does an MRI or magnetic resonance imaging show? To begin with, magnetic resonance imaging is a test that uses a magnetic field and pulses of radio wave energy to make pictures of organ and structure inside the body. In many cases, MRI gives different information about structure in the body that can be seen with an X-ray, ultrasound or computed tomography, or known as CT scan. Magnetic resonance imaging (MRI) has a multi-phase role in sport medicine, providing an accurate diagnosis, prognostication for return to play, and assessment of healing following injury or surgical intervention. MRI also has an extremely high yield in soft tissue injuries, including documenting the extent of muscle damage and the ability to identify intra-articular lesions such as meniscal and articular cartilage injuries. The quality of output generated by MRI is often considered the gold standard because of the modality's exquisite soft tissue contrast, multi-planar capabilities, and non-invasive procedure. Common sport injuries that may require an MRI scan are muscle, tendon, and joint injury, as well as stress fracture. In many cases, injured muscle, for example, account for up to 1/3 of all sports-related injuries, representing a major challenge for many athletes. The majority of muscle injuries occur around the myotendinous junction, the weakest point in the muscular tendinous unit. Muscles that are prone to strain typically cross two joints, have a high percentage of fast-twitch muscle fibers, and have a propensity for eccentric contraction. These strains commonly occur in the groin and hamstring in many athletes. Muscle strains are clinically graded as first, second, or third degree strain, and an MRI examination can visualize the extent of the injury. The degree of a muscle strain is often described in 3 levels of increasing intensity. This is a grade 1 injury of semimembranous muscle. There is diffuse muscle edema giving a feathery appearance. The tendon at the myotendinous junction appears continuous of normal caliber and shows uniformly low signal intensity. For the second image, there is mild degree of perifacial edema. No obvious discontinuity of disruption of muscle fiber visible. Second degree strains show partial thickness of the myotendinous junction, manifested by edema, hematoma, and partial destruction. There is presence of a partial destruction of muscle with hematoma formation around the myotendinous junction, and partial destruction is usually depicted as a focal well-defined area of high signal intensity or fluid signal intensity on images. The tendon adjacent to the myotendinous junction also may be thickened and exhibit features of laxity and partial destruction. Second-degree muscle strain has moderate to severe perifacial fluid. This is an example of grade 2 injury involving the semimembranous muscle. A focal area of high signal intensity seen within the muscle fibers of semimembranous representing partial destruction of the fibers. The tendon at the myotendinous junction appears normal, and there is mild degree of perifacial fluid. A third degree strain is documented in an MRI as the complete destruction of the myotendinous margin and retracted muscle. It causes complete destruction of the myotendinous junction with a local hematoma filling the gap created by the teeth and complete avulsion injuries from the bony attachment. It also causes intramuscular hematomas. In addition, MRI can also differentiate tendon avulsion and myotendinous rupture, which is essential when considering if a patient requires surgery. For the grade 3 injury example, the tendon appears normal approximately. However, there is complete discontinuity at the tendon here. And this is the part of proximal tone, and this is the distal tone surrounding the muscle edema. Besides muscle injury, 1/4 to 1/2 of all sport-related stress fracture occurs in tibia. Incomplete transverse fracture occur along the anterior or posterior tibial cortex, Radiograph may show an intracortical fracture line, or sometimes there will be just mild focal parietal reaction representing immature callus. In the case of healing stress fracture, and that may be the only abnormality visible on radiograph. This radiograph shows intramedullary nail incomplete transverse line along the anterior tibial cortex, an example of stress fracture. So, is imaging required before return to play? It is a major challenge to decide whether an athlete can safely return to play. MRI can be done to assess return to play decision. However, normalization of increased signal intensities on MRI is not required for a successful return to play, suggesting that functional recovery precedes structural recovery at imaging. Why we use MRI? What is the advantage of MRI in imaging sport injury? The answer is MRI has equivalent sensitivity to isotope bone scanning for the detection of bone stress, but provide considerably more anatomical information without exposing patients to ionizing radiation. MRI also provides excellent delineation of both deep and superficial soft tissue in a more panoramic and less operator-dependent format than ultrasound, and is the best non-invasive imaging test for injuries of articular cartilage and fibrocartilage. Moreover, MRI can be used to characterize the muscle injury in detail and with high sensitivity, which allows the radiologist to categorize its severity according to various classifications. Therefore, this classification guides the sport physician's therapeutic approach. For conclusion, radiology plays an increasingly important role in the initial assessment and follow-up muscle injury. The most common mechanism leading to injury of muscle in elite athletes is indirect trauma, which is strain injury, and muscle injuries are responsible for a large proportion of time lost to competition. That's all for MRI related to in-sport injuries. Thanks for watching. Goodbye and Assalamualaikum.